lot of times they're highly stressed, as you well know, which their cortisol levels go through the roof and they don't even realize that that's what's happening to them. So I found some success. Some women are really happy that they've met me, and I want to make sure I help some more.
So that's, I think, where we are aligned because I started looking at this because I saw people on Facebook group and these women are so confused. They're saying, hey, they're asking other women to help interpret their lab results. And I'm
Yes.
like, oh my goodness. And I see one that they'll say, hey, I tried my estrogen. It was up here. Oh, well. And these women are, I was like, wow, dude, I don't see people talking about that about gallbladders or heart. You don't see people trying to give other people medical advice, but that's why I started this campaign called Hormone Confusion, is that everybody seems to be confused about hormones. And to be honest with you, I was confused about hormones when I finished my OBGYN residency. I talk about this a lot, but there's a lot of confusion. And this is, I talk about my labs are normal and I still feel awful. Where did I get that from? I got it from all the patients who came in who were telling me that. So it's a
Yes.
lot of the women that you see. But anyway, can you tell me, because most of the time people have a personal story. It's like I was
Mhm.
doing all of this, and that was mine. I was doing the things for my wife, who's a high performer. And again, all women are high performers, I believe. And it
Yes.
wasn't working. And so that's when I started trying to figure out something else because I was seeing it 24/7 in my household that
Right.
it was doing all the things that you're talking about. So what made you transition from, hey, I'm selling this HRT that the pharmaceutical industry is telling me to promote, and how you said, hey, maybe this is not exactly what I should be doing?
Yeah. Well, it's interesting to note that because there's been so much that's happened since I used to actually sell the drug that I did. And one of them is a study that came out that made women feel like they had to come off of their estrogen completely because of a black box warning. And so by the time I got to a point in my life where I could go on an estrogen, that estrogen no longer existed on the marketplace really in the form that it used to. And I
Mhm.
can tell you that my symptoms that came on board were, for me, weight gain. I've always been very athletic and I would work out like no tomorrow, do more working out, and I would gain weight in my middle. And I didn't understand that it was the cortisol that was happening from my job and the cortisol from me being stressed, trying to work out more, that was causing me to gain more weight. Why? Because I had less estrogen. So once I got with the functional medicine provider, I began to understand that you have to make sure you're balanced first. And your provider can give you a blood test or even a saliva test. But you have to also understand that those ranges are looking for disease. They're not looking for your optimal performance. So the healthcare provider will look at those ranges like they did for me and said, oh, everything is okay. And I said, well, it's not okay. And I advocated for myself and I found a functional medicine provider who said, these say one thing, but your symptoms say another. Your symptoms speak louder than your labs do. And that's where we have to be able to advocate for yourself, like I did, and say, this isn't right. I'm gaining weight like I shouldn't be. I'm bleeding all day long and for weeks at a time. I'm bleeding heavier than normal, or either I'm having periods at 55 when I didn't have one at 54. So all
Mm.
these things pop up for women and they don't understand it's the transition of their estrogen, their testosterone, their cortisol, their progesterone. There's other hormones involved as well, as far as your follicle stimulating hormone is going down because you're going through the actual change. And that's what makes your ovaries actually produce the egg. So for me, being as smart as I was at a quandary. And once I figured out the puzzle by talking with a functional medicine provider and looking at the results with her, then I got on something that helped me. I'm on a bioidentical hormone. I love it. I've been on it for years. I will not go off of it. And it keeps me functioning.
Yeah.
But not only that, my diet had to change. I had to make sure that I wasn't putting things in my body that were causing some of the issues that I was having. For instance, I'm not really good with gluten, but my dad was a baker. So, how does that work out? That means
Yeah.
I know how to bake and I know how to bake very well, but I only have it during the holidays. And the minute I do, it affects my body. So I don't
Right.
have it as much. My son wants banana bread. I said, "You gotta make it." I got everything out for him to make it because 'cause I'm not.
So I think we talked, and I told you that I look at it a little bit differently.
Mhm.
For 20, so this is what I'll tell you. When I did my OBGYN residency, we never really looked at blood because the blood was so confusing. Because
Right,
one of the things is that premenopausal women could have irregular bleeding, they could have endometriosis, and you would look at their blood work and it would say it's normal, and
right,
it was like that can't be right. And then I started seeing people who were postmenopausal, they had endometrial cancer, and their blood estrogen would be normal. And I'm
right.
like, that doesn't make sense. So then I had a patient came in and asked me if I knew about saliva testing. And I said no. And I started looking at it. And this is the thing that changed me is that I finally found a lab that helped me match the symptoms. Because this is my thought is that symptoms come after you've had a long line, you've had a lot of dysfunction. Things
Yes,
have gone wrong for a while by the time the symptom shows up.
right.
So I started saying, how can I get there before the symptom gets there? Because now this is what I'll tell you. When I was doing my residency, we stopped estrogen if they had a positive mammogram.
That's what
That
happened
doesn't make exactly.
because of that
But that
study that came out.
well, no, this is what I'm saying is that the reason why there was a problem is because we didn't understand the balance between estrogen and progesterone.
Right,
That's my whole thing. Is that estrogen causes growth, progesterone slows down the growth and increases development. So
right.
you're right. The stress causes you not to ovulate. When you don't ovulate, you don't make progesterone. When you don't make progesterone, you don't have anything controlling the growth of the lining of your uterus. And also, ovulation is the menstrual timekeeper. So, if
Yeah,
you don't ovulate, your body doesn't know when to bleed, how long to bleed, all of that stuff.
mhm,
So, what I found in saliva testing is that you can look at that balance of estrogen and progesterone. And if you keep that in balance, you can prevent the symptoms from showing up because you're helping them to maintain that balance the whole way. And the
absolutely.
only reason why I like saliva, I mean, one of the reasons why I like saliva testing is that it shows the tissue level. And you're a laboratory person, so you're a laboratory person. But I've just noticed that the saliva testing matches the symptoms, and sometimes when the patient can see it, they're like,
Yes,
"Oh wow, this is real." And
right.
then if you do a treatment and you see that the balance is there before they ever get a symptom, and I don't want to belabor because I want to hear your story, but what I find is that once if they don't see it and they're not sure what's happening, and we go by symptoms, what happens is you give somebody something, you get them to come back in 3 months, you say, well, that didn't work, then you try something else, and then you come back and say that didn't work. So now you're 9 months down the road and you're still trying to adjust symptoms. I've found that if we can have some good data to start with, we can decrease some of that trial and error.